Hello, my dear residents. I am presenting my second video of a clinical discussion series in surgery. This is a continuation of a topic clinical discussion of a breast swelling. In the first video, I have discussed up to history. In this video, I will discuss clinical examination of the breast swelling. I am keeping it as far as possible a clinically oriented with a necessary supportive theoretical background expected from the surgical resident to clear your examinations. I believe this will also give you good concepts of a surgery which will make you sound in analysis and application of the subjects expected from a surgeon. So, shall we go ahead? Here, what are the different positions of the patient during breast examination?
Sitting position, leaning forward position.
Okay, we can divide like this. During inspection, patient sitting on the stool or a chair with the arms by the side of the chest. That is the common position utilized for the examination. And some patient raising both arms above the head level so that if there is any swelling or a dimpling of the skin can become a much more prominent. Patient bending forward from the waist so that breast will fall away from the chest. In this position, we can make it out whether the swelling is arising from the chest wall or is it arising from the breast. Sometimes we may have to make it out whether the swelling in the breast also sometimes get fixed to the chest wall. So those arising from the chest wall, those fixed to the chest wall will not fall away from the chest during the bending forward position. Those swelling which are in the breast will fall away. So that position will be helpful in the inspection. During palpation, a semi-recumbent position and a recumbent position also will be used if the patient is shy enough to sit. Patient keeping her hand over the iliac crest and pressing and relaxing it on demand on being asked. That also will be helpful to know whether it is fixed to pectoral muscle or not. Patient pushing the wall and examining, that will be to know whether the swelling is fixed to serratus anterior. The patient who is in a semi-recumbent position or recumbent position, if you wanted to test whether the swelling is a cystic or a solid, that will be helpful. Yeah, go ahead with the examination.
Position of the patient and exposure. Patient is sitting on the chair with arms by the side of chest. Whole chest is exposed. Inspection. Both breasts are present. They are symmetrical in size and shape. No obvious swellings are seen. Right breast examination. Nipple is present in its position. Normal in size, shape, color and direction. No retraction of the nipple. No swellings, ulcers or fissures are seen. No discharge from the nipple. Areola. Size, shape, surface and color is normal. No ulcers and swellings are seen. Skin. Skin normal. No dimpling, no pudiorange, no redness, no edema, no skin nodules, no ulcers and no engorged veins are seen. Axilla. Normal. No swellings are seen. Arm and thoracic wall. No brawny edema noticed.
Why do you want to expose both the breast?
For comparison purpose.
Yes, it is good for the comparison of the purpose, especially for the asymmetry to know and also any swellings to be prominently be seen. Yes. What are the conditions of asymmetry of the breast?
Infused tumors and infections.
Not only that one, we can see the asymmetry in congenital absence of one single breast, amesia. This may happen very rarely, but still it is in a condition which has been described. And second is the ANDI, that is due to aberration in normal development and involution of the breast noticed in the young people that may result into the asymmetry of the breast. Third, the acute mastitis or a breast abscess may result into the asymmetry. Chronic infections such as filarial infection or tuberculosis also will lead to asymmetry. Benign tumors of the breast such as a giant fibroadenoma or a phyllid tumor, lipoma, neurofibromas also causes a asymmetry. Malignancies, carcinoma, sarcoma may lead to asymmetry, and miscellaneous conditions such as a parasitic cyst and galactoseals also will result into the asymmetry. What diseases cause nipple discharge changes? What diseases cause nipple changes?
Carcinoma breast and benign tumors.
Okay, but we can divide into the as per the size of the nipple is increased due to infections when there is a inflammatory process is going, such as an ulcer or a fissure. The tumors such as a papilloma can also arise from the nipple, resulting into the difference in size. During the lactation, the nipple size will definitely increase. The shape of a nipple is altered in a retracted nipple or in ductectasia, third in Paget's disease, or sometimes tumors arising from the nipple also. Color of the nipple changes, that becomes dark brown during the late phases of the pregnancy and during lactation. In Paget's disease, there will be red weeping surface. In eczema, there will be a red scaly surface noticed on the nipple. The direction of the nipple will be altered in carcinoma breast and in large fibroadenoma. Normally, the direction of the nipple will be downwards, forwards and laterally. Normally, the direction of the nipple is downwards, forwards and laterally to breastfeed the babe in the arms. To breastfeed the babe in the arms, it is a downwards, forwards and laterally. So that direction will be altered in carcinoma breast and large fibroadenomas. What are the differences between the Paget's disease and eczema?
Nipple is first involved in Paget's disease. Areola is first involved in eczema.
Correct. But the thing is, that is the only thing is not the thing. There are certain other things also can be considered before we decide whether it is a Paget's disease or eczema. Paget's disease is usually unilateral, whereas eczema is bilateral. In Paget's disease, as you said, nipple is first to be involved and spreads to the areola, whereas in eczema, it starts in the areola and involves the nipple later. In Paget's disease, it may be associated with the underlying breast lump, whereas there is no breast lump seen in eczematous condition. Nipple is destroyed in Paget's disease. Nipple is preserved in eczematous conditions. It need not be present during the lactation in Paget's disease, but it is very commonly seen during lactation in eczematous condition. There are no history of allergies in Paget's disease. There can be a history of allergies such as hay fever, other things, and these allergic symptoms may get exaggerated with the allergic substances exposed or ingested. What are the different causes of a nipple retraction?
Congenital retraction and in carcinoma breast.
Not only that, you can see the retraction of a nipple congenitally, in traumatic fat necrosis, in chronic abscess or a chronic periductal mastitis, in fibroadenosis, in ductectasia and in carcinoma breast, that is a recent retraction, very important. What are the different types of a nipple retraction?
Slit-like retraction seen in ductectasia, fibroadenosis, chronic abscess and traumatic fat necrosis. Circumferential retraction in carcinoma breast.
Very good. So those are the two types and they are seen in a different conditions that will be noticed. What is the cause of a nipple retraction in carcinoma of breast?
I don't know.
More than 80% of the breast carcinomas, that is a squamous carcinoma, atrophic squamous carcinomas are more than 80%, show a productive fibrosis involving the epithelial and stromal tissues. When lactiferous ducts are involved in fibrosis, they get shortened to retract the nipple. When Cooper's ligaments are involved, dimpling or a puckering of the skin is noticed. What are the skin changes noticed in carcinoma of breast?
Pure orange ulceration.
Not only there, other things are also there. Dimpling or puckering or you call tethering. Second is a skin fixation. Third is a powder orange or a orange peel appearance. Fourth is a inflammatory changes noticed. Brawny induration also can be noticed on the skin. Ulceration can also sometimes may be associated. Satellite nodules also will be seen. Yes. What is the cause of a powder orange appearance in carcinoma breast?
Infiltration of subdermal lymphatics with malignant cells.
Yeah. Infiltration of subdermal lymphatics by malignant cells results in the edema of the skin. The sweat gland ducts which opens on the surface of the epidermis. Sweat glands are present in the dermis, that is mainly in the reticular dermis. From there sweat ducts will come out and they open on the surface of the epidermis to completely moisturize the skin. But these ducts will not get elongated along with the edema of the skin. So wherever sweat duct openings are present, so naturally they are shortened and depressions like a orange peel appearance is noticed. What is the cause of a ulceration or a presence of a satellite nodules on the skin in carcinoma breast?
It is due to malignant infiltration of the skin.
Right. What is the importance of above findings?
Tumor stage becomes T4B.
Right. Tumor staging will become a T4B due to the skin infiltration. So, presence of skin ulcerations, skin nodules, powder orange appearance, irrespective of the tumor size, considered as a T4B stage. Why do the skin involvement in carcinoma breast considered as a T4B of a TNM staging?
I don't know.
The subdermal lymphatics draining the skin have a communications with the intercostal veins. Intercostal veins are connected to vertebral plexus of vein. So, a malignant cells reach the vertebra and a systemic circulation through these connections. So, that's why it is considered to be a T4B advanced. What disease causes a brawny induration of the breast?
Inflammatory carcinoma.
Not only that, you can see even in a simple conditions such as a erysipelas or a scleroderma also brawny induration is noticed, and you may have to differentiate from the inflammatory carcinoma these conditions. What are the causes of a brawny edema of the arm and axilla?
Involvement of the axillary lymph nodes in carcinoma.
Yeah, right. Lymphatic obstruction due to infiltration of the axillary lymph nodes in carcinoma breast causes a brawny edema of the arm and axilla. Similarly, as a post-operative complication of a modified radical mastectomy also may result into this brawny edema. And in filariasis of the axillary lymph nodes also, with a secondary infection, sometimes there will be brawny edema and the axilla will be noticed in filariasis axillary lymph nodes. What is cancer en cuirass?
It is seen in carcinoma breast.
You are right. It is seen in carcinoma breast. The literal meaning is a coat of armor. It is seen in advanced carcinoma breast. So skin is thickened with multiple nodules over the thorax and arm. What is the cause?
It is due to infiltration of the skin resulting in nodules and edema is due to the lymphatic obstruction.
Right. So proceed with the palpation.
Palpation. Patient is in sitting posture and a doctor by the side of the patient. Palpated with the palmar surface of the fingers of flat hand. First supposed to be to normal breast first and then diseased breast. Palpated all the quadrants of the breast in a clockwise manner and at the end nipple and behind the nipple with fingers. Palpation findings. Single swelling 4 into 5 into 5 centimeters in size, ovoid in shape with irregular surface and irregular margins present in the upper lateral quadrant of right breast. There is no rise of temperature, no tenderness over the swelling. It is hard in consistency. Restricted mobility of the skin over the swelling is seen and puckering of the skin is noticed when the swelling is moved. Swelling is fixed to the breast tissue and fixed to the pectoral muscle. It is not fixed to chest wall. On palpation of nipple and behind the nipple, no abnormality found and no discharge is noticed.
Yeah, you mentioned three dimensions of the swelling. Very good. Because in the breast and also in the scrotum, where you can make out the three dimensions, you should not say only two dimensions. 4 centimeter, 5 centimeters into 5 centimeters. So three dimensions you made out. That is very important for us in the management purposes. That will be helpful. Yeah, and also for the staging purposes. Why do you want to palpate normal breast first in this patient?
To know the texture of the breast, which varies from person to person, and to know what is normal for that patient.
Right. So we must know about the first texture of the breast of that patient. Then only we can make out the diseased breast texture. What are the different quadrants of the breast? How it is divided?
Breast is divided into four quadrants by two imaginary lines drawn perpendicular to each other, passing through the center of the nipple. Four quadrants of the breast are upper medial, upper lateral, lower medial, lower lateral. Upper lateral is the largest with extension into the axilla.
Why carcinoma breast moves with the breast tissue?
Carcinoma breast is fixed to the surrounding breast tissue by fibrous strands.
Yes. Suppose if, in a fibroadenoma, it moves freely in the breast tissue. It will not move along with the breast tissue. It moves freely. That's why it is called as a mouse in the breast. It is freely. Whereas carcinoma, which extends into surrounding tissue with the fibrous strands, so naturally it is fixed to the breast tissue. I have already told you, majority of the carcinomas will produce a nearly fibrous strands, stroma. What is importance of a puckering of the skin?
Puckering is due to the involvement of the Cooper's ligaments.
Yeah, puckering or a dimpling of the skin is due to shortening of the Cooper's ligament. Cooper's ligaments are a fibrous strands passing from the skin to the pectoral fascia through the breast tissue. They get entangled in carcinoma and shortened. On examination, skin is not fixed to the tumor. Restricted mobility of the skin over the tumor is present when this puckering or a dimpling is noticed. So there is a restricted mobility will be noticed, but it is not fixed, skin is not fixed to the tumor. That is the one important point. What is the importance of a fixity of the skin to the tumor?
In malignancy, infiltration of the skin results in fixation of the skin to the tumor. Skin cannot be pinched or moved over the tumor.
Right. Is there any change in the tumor staging or a treatment with a puckering or a nipple retraction?
No, staging will only change when the skin is infiltrated.
Right. So one should remember that just because there is a dimpling is there, it cannot be considered as a infiltration into the skin. Only when the skin is fixed to the tumor and cannot be mobile over the tumor, then only we can think the skin is infiltrated. Similarly, nipple retraction should not be considered as a fixity to the tumor because of a shortening of the lactiferous duct which are involved in the fibrous strands of the carcinoma may result into the retraction of the nipple. So just because retraction of the nipple is there, don't consider it as a involvement by the tumorous tissue. So its staging will not change. How to test swelling's fixity to pectoral muscle?
Asking the patient to press against the hip and moving the swelling in the direction of the muscle fibers. Mobility of the swelling is restricted when the muscle is contracted. The swelling should be mainly in the upper lateral and lower medial quadrants.
Right. To which portion of the muscle the swelling is fixed?
Sternal portion of the pectoralis major muscle.
Yeah, right. How to test the upper medial quadrant swellings fixity to underlying muscle?
I don't know.
Upper medial quadrant swellings are lies on the clavicular portion of the pectoralis major. Pectoralis major has got a sternal portion and a clavicular portion. Adduction of the arm against the resistance make a clavicular portion of the muscle contracted. Adduction of the arm against the resistance makes a clavicular portion of the muscle contracted. On contraction of this muscle, the mobility of the swelling is restricted if it is fixed to that portion of the muscle. Right? How to test the lower quadrant swelling's fixity to underlying muscle?
Lower quadrant swellings lies on the serratus anterior muscle. Serratus anterior muscle made to contract when the patient pushes the wall. The mobility of the swelling is restricted during the contraction.
Right. How to test the swelling's fixity to pectoral fascia? By adduction and external rotation of the arm. By adduction and external rotation of the arm, fascia can be stretched. The mobility of the swelling is restricted if it is fixed to the fascia. What is the effect of a swelling's fixity to pectoral muscle or a fascia on staging or a treatment?
It is T4A stage.
You are right. Oh, but when the swelling is fixed to serratus anterior, it is T4A. But when the swelling is fixed to the pectoralis muscle and fascia, it will not change the staging of the tumor. So, during the treatment, only thing is that during the treatment, post-operative radiotherapy is indicated even after the Patty's mastectomy. So, that means when the swelling is fixed to the pectoral muscle or a fascia, the staging will not be altered. But during the treatment, this patient is required the post-operative radiotherapy even after Patty's mastectomy. What is the effect of a swelling to serratus anterior or staging and a treatment? Swelling is fixed to serratus anterior, considered as a chest wall involvement and becomes a tumor stage T4A. So treatment depends upon the TNM stage. So when the tumor is fixed to the serratus anterior or even to the intercostal muscles or ribs, it is considered as a T4A. The treatment is further depends upon the other factors such as nodal and metastatic factors. So TNM stage. What is the stage of a Paget's disease of the nipple?
I don't know.
Paget's disease of a nipple without a tumor considered as a carcinoma in situ, that is a tumor in situ, TIS. Suppose if the tumor is palpable behind the nipple, the staging will depend upon the tumor features such as the size. So depends upon the size of the tumor. Then only we can decide what is the staging of that disease. So Paget's disease is mainly depends upon the presence of a tumor behind the nipple and areola. Yeah. The next examination. Continue. Please continue with the examination.
Right axillary examination. Pectoral group of lymph nodes are palpable. 3 in number, 1 to 2 centimeters in size, not tender, hard in consistency, and freely mobile individually. Supraclavicular lymph nodes are not palpable. Left breast and left axilla normal. Chest, lungs. Bilateral air entry is equal and normal. Abdomen. Liver is not enlarged, no mass is palpable. No free fluid is in the abdomen. Vaginal examination. Fornices are free, no mass is palpable. Skeletal system. No bony tenderness, no bony swellings or fractures over flat bones, long bones and vertebra. CNS. All cranial nerves are normal, No sensory or motor deficiency elicited.
Yes, you have thoroughly examined even for the metastasis also. Good examination. Then I want to ask you, why did you examine the supraclavicular region in this patient?
Supraclavicular lymph nodes are likely to involve in carcinoma of breast.
Right. Why should the abdomen be examined?
In carcinoma of breast, metastasis spreads to liver and peritoneal cavity and ovaries.
How the metastasis spreads to abdomen?
Blood spread and lymphatic spread.
Yes, by blood as well as the lymphatics, the spread will causes the metastasis. If it is a lymphatic spread, it causes metastasis on the surface of the liver. So it may be presented as secondaries on the surface of the liver. If it is through the blood spread, it causes metastasis in the liver substance. How it spreads to ovaries?
By permeation.
Yes, it is said to spread by a permeation. The malignant cells reaches to the surface of the ovary to produce a metastasis called Krukenberg's tumor. It is said that in the peritoneal cavity, the malignant cells may seedle, and this seedling, just like a amoeboid movements, it may reach over the ovary surface. It is said to be malignant cells just in the peritoneal cavity may reach to the surface of the ovaries and resulting into the Krukenberg type of a tumor. The peritoneal carcinomatosis also causes in the same manner to produce ascites and seedlings. I told you the malignant cells which are present in the peritoneal cavity, they will produce ascites and seedlings. What type of a carcinoma of breast affects the ovaries also?
BRCA1.
Yes, in BRCA1 and also BRCA2, they may be synchronously, that means simultaneously they can be present, or sometimes need not be. But other carcinomas, yes, they can be due to the metastasis, so they can be metachronous. That means after 6 months of the first breast carcinoma develop. What type of a carcinoma causes a peritoneal carcinomatosis?
I don't know.
It is a said that is a labular invasive variety with high grade variety may reach to the peritoneum, and it is said to be a really dangerous variety which causes a death early phases. What type of a carcinoma of breast produces a brain and bony metastasis?
I don't know.
It is a luminal A variety, which I discussed much about in my last video. Luminal A variety, which is having a hormone receptors. What type of a carcinoma of breast causes a soft tissue metastasis, such as in lungs and liver?
I don't know.
It is a basal-like carcinoma that I have discussed, that is a triple negative. All hormone receptors, ER, PR and HER2 receptors are absent in these cases. So, thank you with this video, and I expect it will be useful for you. Good.